Good afternoon, ladies and gentlemen. Thank you for your kind invitation to address you at the end of a very long but intense day. I have listened with great interest, particularly this last discussion. And of course, it offered some very valuable insights and engagement. First of all, let me start by saying that it is really great to witness the progress that has been made possible by the IMI platform, bringing together private and public resources. And joining resources can be just what is needed to make the last push for innovation happen where public or private interests would not manage alone. This is for us the guiding philosophy, certainly from a health policy perspective. And I think for the next version of the IMI, the successor to the current IMI, this will even be more relevant. Because the next IMI, more than the current one, or previous ones, will have to focus on making things happen. We've gone, I think, now way beyond the stage where we're learning how to experiment with working with each other. We know how to work with each other. But the issue is, can we identify, for example, the issues that require our joint attention? This will be key, because the IMI is a very powerful tool, and we need to direct it where it can give the most benefit. Of course, from a health policy perspective, again, we fully support novel partnerships in health, like the IMI and others. And the topic of today's event, digitalization, is indeed one which is at the very heart of the future of healthcare in Europe. And this has an obvious consequence in that digital actors, public and private, need to be given a central place at the table of future partnerships. So that's the first point, which I think has come out very clearly today as well. I would just like to mention a few points in my concluding remarks. First is that there is a very, very strong link between digital health and what's going on in healthcare systems. Digitalization of health is not just about, of course, adding a digital layer on top of existing systems. It's about transforming those systems. And health systems are at a stage where they need transformation, certainly in Europe, and I would say also globally. Innovation is both pulled and defined by the healthcare systems, certainly in a European setting. And I would go further to say that innovation can only be successful if the healthcare systems are fully taken on board from the very beginning. This means paying very careful attention to issues like sustainability and access, which, if not tackled, and we are seeing also signs of that, if not tackled, will lead to a very conflictual situation, which will make collaboration difficult, more difficult, not easier. And this is an important lesson to take with us if we want to develop new partnerships, stronger partnerships in health. And of course, the Director General I represent, Health and Food Safety, has a great responsibility to ensure that we can help foster an environment which is conducive to this. Now, at EU level, as you've already heard, a lot of work is ongoing to promote a digital transformation of health across member states. Again, not just for its own sake, but because we need a transformation that places patients at the center and fosters innovation. You've heard already some examples. My colleague Despina was mentioning also the significant progress made in exchange of e-prescriptions and electronic patient data. Yes, maybe the initial stage is still maybe a modest one, but it's developing fast, it's picking up fast, so much so that we are quite confident that by mid-2022 we will have 22 member states exchanging electronic patient data. This is something which was unthinkable even a few years ago. So things are really, I think, accelerating very fast. Nonetheless, there are still important obstacles. I point them out not to be the prophet of doom, but because we need to pay attention to this. First, we need to ensure that all member states move at the same speed. The European Union is also about cohesion, also about ensuring that we can reduce inequalities. We cannot have some member states playing in the Premier League and some in the third division, certainly not on issues like health, which are fundamental to citizens. We need to avoid the digital divide. It would be the ultimate irony if digital technology, which is supposed to make and should make location less relevant, ends up making location more relevant because some are prepared for it and some are not. That would be the ultimate irony and the ultimate tragedy. And we need to increase and invest strongly in interoperability. We have to make sure that whatever is happening in our health systems and our health infrastructure is now open-ended. And we are looking at this, for example, already on how we can also direct European funds in the right direction, to help use European funds to foster interoperable investments. I believe we are making steady progress. All these issues are being addressed, are being tackled. I am confident we can create an innovation-friendly environment for digital health in the EU, but this will need continued work and cooperation from all sides. There are, of course, some excellent examples that already show that member states' health systems are willing to adapt to new ways of working. I will just mention one, which is perhaps one of the flagship initiatives over the past few years, the European Reference Networks, the ERNs, which is certainly an innovative approach in healthcare developed by the EU in the last few years. Through the European Reference Networks, we have brought knowledge and expertise on rare diseases from among all member states and Norway together with the full involvement of other stakeholders, patient organizations in particular. We have 24 ERNs covering all major rare disease groups launched in March 2017, including a specific reference network on rare neurological diseases. And the European Reference Network on Rare Neurological Diseases includes 32 of Europe's leading expert centers in 13 member states. And we will be launching further calls in the coming weeks and months. Initiatives like the Brain Health and Diseases in the Digital Era 2020 and beyond are crucial to address the unmet needs of more than 500,000 people living with rare neurological diseases in Europe. Let me just point out that 60% of those patients, 60%, are still undiagnosed. And this has enormous consequences, not just on their medical care, but also on other aspects. If you don't even know what you're suffering from, that's already a major hurdle. And consequently, many of the diseases do not have, as we speak, effective treatment. And there is, in many of them at least, a lack of research and even of expertise. But through coordination and the transfer of knowledge, because the key concept in the ERNs is that it should be the knowledge that should travel as much as possible, the ERNs, in this case on rare neurological diseases, will establish a patient-centered network to address the needs, and I stress all needs, of patients of all age groups with or without a definite diagnosis by implementing an infrastructure for diagnosis, evidence-based management, treatment, and collection of patient data. I mentioned this example of ERNs because one particular and relevant characteristic of the ERN system is its virtual character and the key role that the IT and digital innovation is playing in its effective functioning. But this is, of course, just the beginning. We can certainly use the ERNs as an environment for research. ERNs can help us implement important changes by collecting clinical data on rare disease patients across the EU, generate better knowledge and new evidence. And this data and evidence, we are already contributing to producing better clinical guidelines for care, innovative research, new medications, medical devices, and diagnostic techniques. We also will continue to invest strongly in patient registries and databases, particularly in areas where critical mass is a major issue. Areas like rare diseases and also cancer, to advance clinical research, to improve patient care and healthcare quality evaluation, and also to plan the best way of pooling data to achieve a sufficient sample size for epidemiological or clinical research and healthcare quality evaluation. We're also, within the context of the ERNs, looking at how we can apply artificial intelligence, for example, to speed up diagnosis or to improve the quality of the diagnosis. And artificial intelligence, the lessons learned in this natural laboratory, if I could use that term, will be another promising and important step forward that can then be applied also, I'm sure, to other sectors. To conclude my intervention, I think, of course, the IMI works within the environment of the research program, and of course, Many of you are very familiar with that program. But I think looking ahead to the next multi-annual financial framework, 2021-2027, where I must say there is quite a strong health dimension. The word health appears very frequently, not just in the research program proposal, but also in many of the other large programs. And it is a time when, obviously, efficiency in public spending is an imperative. And the only way we can achieve that efficiency is by making sure that we use all the programs in synergy with each other and for the optimal purpose for which each of those programs was created. We have been investing very strongly in this, for example, to ensure that member states and stakeholders have the full capacity to fully exploit and use all the opportunities that all the programs offer. The programs are a toolkit. Each tool has specific strengths and obviously, by nature of design, limitations. And many of the complex issues we are facing, certainly in the area of health, will require the use of multiple tools. There might be a research component, there might be a component of rollout of results into health systems, there might be a component of digitalization, and there are programs which are designed for each of those specific purposes. So it's really important, I think, to not just look and have a knowledge of individual programs, but also how those programs can interact. Coming to the research program, and one of the issues I think which we also all have to reflect a bit on is also how to improve the implementation of research results. I think if we, hand on heart, I think we acknowledge that the research programs, the framework programs over the years have been very successful in generating knowledge, but maybe less successful in actually transferring that knowledge to the marketplace and to health systems. And we need to do much better than that, particularly if we're asking European taxpayers to support an expanded budget. They need to see the results of that. I think this will be the key test in 7 years' time, whether actually we can demonstrate that we have managed to improve the implementation of research results. And that's something which will require also a partnership in itself. We will need to make sure that the innovators, the health system managers, those who have to take the decisions, and all other stakeholders, professionals, patients, are fully on board and fully agreeing on the priorities. And last but not least, all this has to go hand in hand with structural reform. You cannot easily accommodate innovation in systems that are old-fashioned, that are obsolete, that are not able to absorb innovation. It requires too much retrofitting, and that is very often expensive and very inefficient. So all this has to go hand in hand, and even from the latest this year's cycle in the European semester, you will notice that there is a lot more attention being paid on more long-term reform in health systems. And this is something that certainly in the European Commission we will continue to ensure, that we also need to have certainty that our health systems that ultimately define the European health market are actually able, are innovation-friendly, and are able to clearly specify where they need innovation and where they need new solutions. If we can do that, and I think we can, then we are in a very good position. I think Europe can use its critical mass. Europe can use its unique character, which is the only region which has all the structures it needs from the political level to the scientific level to actually take decisions and implement them. The rest is up to us, and I think if we can use instruments like the IMI, and especially what will come after the current IMI, to support that process, then the prospects look very good indeed. Thank you very much.